Change is happening in our community. People have received the message about the importance of taking care of their health by eating better, exercising more, and not using tobacco products. While we have begun to meet this challenge, there is much more work to be done. The success of our efforts will be determined by the strength of our commitment to policy, systems, and environmental change in our schools, work sites, and community in general. The changes are not difficult, but the community needs to commit to this positive legacy for future generations where we live, work, and play. Building the community infrastructure for healthier living is where we will begin.
Why do people move to an area or stay in an area? It usually starts with schools, quality of life, recreational opportunities. People want to live in a neighborhood that they can feel comfortable, that they can feel that their children are safe. And when you're involved in a planning project, that's the time.
Many chronic diseases can be taken back to poor nutrition and lack of physical activity. And sometimes the lack of physical activity is because we have built our environment, our communities, in a way that it discourages people from being out and walking and bicycling and moving about. We've made it so that it's just for cars. When the connector road was built through Cumberland Head, it was an opportunity for a road to be built that also could accommodate bicyclists and walkers. Therefore, a recreational multi-use path was developed alongside the connector road.
The Saranac River Recreation Trail, there has been just a groundswell of people, grassroots people from right here in the community that value the beauty of the surroundings and really have been the momentum behind this. We want to be able to have access to our waterfront. We love the beauty of it, the fishing and the other recreational opportunities that it provides. We take our marching orders from the public, and this is something that the public has demonstrated that they really value and are interested in.
This is a disc golf target. It's one of the 9 holes we have at our disc golf course here at the town of Plattsburgh in Cadyville. It's been around a long time. It's relatively new to this area. A local resident lives here in the town of Plattsburgh, came to me with the idea of building a disc golf course. He'd played disc golf courses around the state, he played in Vermont, and he really felt this would be a neat activity, something new to this area, actually open to everyone. The course is free. You just show up and you play.
There are approximately 13,000 people over the age of 60 in Clinton County. What we would like is for people to age in place and be able to age in their own home or in the community. When we're developing any kind of housing, we need to make sure that there's food available, they have the ability to walk to where they need to get to, or to walk to public transit if that's available. We need to make sure that that infrastructure is there for them.
Just as important are providing opportunities for better nutrition for our residents.
We offer many of the partners the opportunity to apply for grants to help them expand the options available either in physical activity or nutrition. Beekmantown applied and received money for soup tureens. Doesn't sound like a big deal, but what happens is that gives the school nutrition manager the opportunity to offer homemade, lower sodium, low-fat soups, fresh, and giving the students and faculty and staff the opportunity to buy those instead of perhaps a canned product.
The students really enjoy all the different choices we have. There's not just one, but there's like 7 or 8 a day. We have the low-fat milk. We have a vegetarian meal that's served every day, 5 days a week.
Well, you see fresh fruit on the line behind me. That is one of the options we have available so that when students are going through the line, they can choose a piece of fresh fruit, and it has to be easy and accessible. So one of the things we're working on is a point of sale offering to make it visible to students, to make it normal, to make it healthy choices, and those are the normal choices. The same token, you take the less healthy choices and you make them less accessible to students so that they may not be as apt to take those and will take the healthy options instead.
Much work has been done in tobacco prevention, but more can be accomplished. Many local municipalities and worksites have taken steps to reduce people's exposure to secondhand tobacco smoke by developing and implementing tobacco prevention policies.
One of the biggest complaints that we had, especially with patients and visitors, was the number of people that were smoking that were actually clogging up different entrances to the medical center. We would constantly hear about this, and of course people that were coming in here were often already compromised with their health. So in November of 2006 we announced that in a year we would be going with a completely tobacco-free campus, not only our main campus but all of our satellite offices. We gave a year's notice because we wanted people to have time to get used to that. We wanted certainly our own employees to have every opportunity to stop smoking if they would, or if nothing else to be able to control the amount of smoking that they needed to do so that they could get through at least in a 4-hour block.
The changes we need to see will not happen overnight, but they will happen over time. Don't let another generation be placed at increased risk for chronic disease and face shorter lifespans. Don't let another generation grow up thinking that food only comes from grocery stores, that cars are the only way to move around a community, and that secondhand smoke is okay. Join us in this effort to improve the health of you, your family, and future generations. Join us because together we can do this as a community, and you can be part of the change.